Did you know that more than 300 million men worldwide struggle with erectile dysfunction, and that one of the most prescribed solutions, Tadalafil, can last up to 36 hours in your body? But here's the real question. What exactly happens inside you when you take this pill? In this video, we're going to break down step by step how Tadalafil works in your body, from the very first minute after you swallow it, to the powerful effects it can generate in your blood vessels, your heart, and of course, your sexual performance. And stay with me until the end, because around chapter 6, I'll reveal a surprising effect of Tadalafil that has nothing to do with sex, and yet it can change the quality of your life completely. So, let's dive in. Tadalafil is not just a little pill for sex. It is actually a scientifically designed drug that belongs to a class of medications called PDE5 inhibitors. But why was it created in the first place? Back in the 1990s, researchers were looking for ways to improve blood flow in the human body. The idea was to help with heart and circulation problems. But then something unexpected happened. Patients in the trials started reporting improved erections. That was the turning point. By 2003, the FDA officially approved Tadalafil under the brand name Cialis. Unlike Viagra, which lasts about 4 to 6 hours, Tadalafil stood out because its effects can last up to 36 hours. That's why it became known as the weekend pill. But here's where it gets interesting. Tadalafil doesn't magically create an erection. It works only when there is sexual stimulation. Without that, nothing happens. And in the next chapter, you'll discover why this detail is so important for understanding how the drug truly works in your body. Before we understand how Tadalafil works, we need to understand what happens during a natural erection. When a man is sexually stimulated, the nerves in the penis release a powerful chemical called nitric oxide. This molecule tells the smooth muscles in the blood vessels to relax. As those muscles relax, blood rushes into the corpora cavernosa, the spongy chambers inside the penis. The penis fills with blood, the veins close to trap it inside, and that's what creates a firm erection. But here's the problem. In men with erectile dysfunction, another enzyme, PDE5, phosphodiesterase type 5, breaks down the very signal that keeps blood flowing. It's like having a green light for circulation, but then PDE5 turns it red too quickly. The result? The erection becomes weak or disappears. And this is exactly where Tadalafil comes in. In the next chapter, we'll see how this small pill blocks PDE5 and keeps the blood flow alive much longer than nature sometimes allows. Now that we know the problem, PDE5 breaking down the signals too fast, let's see how Tadalafil solves it. Once you swallow the pill, Tadalafil is absorbed through your digestive system and enters your bloodstream. Its main mission is simple: block the PDE5 enzyme. By inhibiting PDE5, Tadalafil prevents the breakdown of cGMP, the chemical messenger that allows blood vessels in the penis to stay relaxed and open. Think of it this way. If PDE5 is the brake on your erection, Tadalafil is the foot that keeps the brake pedal lifted, letting blood flow continue without interruption. The result? Stronger, longer-lasting erections when sexual stimulation is present. But here's something fascinating. Tadalafil doesn't just stay in one place. It circulates throughout your entire body, interacting with blood vessels in other organs too. And this is why its effects can last so long, and why it's sometimes used for conditions beyond erectile dysfunction. In the next chapter, we'll talk about the timeline of Tadalafil in your body, how fast it starts working, when it peaks, and why some men call it the 36-hour pill. So, how long does it really take for Tadalafil to kick in, and how long can you count on its effects? After you swallow the pill, it starts moving through your digestive system and enters your bloodstream. For most men, the first effects can be felt within 30 minutes, but the peak concentration usually happens about 2 hours after taking it. Here's the surprising part. While Viagra and other similar drugs fade away after 4 to 6 hours, Tadalafil has a half-life of around 17.5 hours. That means it stays active in your system much longer. In fact, its effects can last up to 24 to 36 hours. That's why many people call it the weekend pill. One dose can cover you for almost 2 days. But don't get confused. This doesn't mean you'll have a constant erection for 36 hours. Tadalafil simply keeps your body ready to respond to sexual stimulation at any time during that window. In the next chapter, we'll uncover why Tadalafil is not just about erections. It has other effects on your body that might surprise you, some even unrelated to sex. Most people think Tadalafil is only about sexual performance, but scientists soon realized it can do much more. Because Tadalafil works by relaxing blood vessels, doctors discovered it could also help men with benign prostatic hyperplasia, BPH, a condition where the prostate is enlarged, causing urinary problems. Studies have shown that a daily low dose of 5 mg can significantly reduce symptoms like frequent urination, weak stream, or difficulty starting. Even more, Tadalafil has been studied in cases of pulmonary hypertension, a type of high blood pressure in the lungs. By dilating the vessels, it can improve oxygen flow and reduce strain on the heart. So yes, Tadalafil is more than a sex pill. It's a vascular health drug with multiple medical applications. And here's the twist. These wider effects are also the reason why Tadalafil must be taken carefully and only under medical supervision. But what about the risks? In the next chapter, we'll look at the most common side effects, from the mild headaches to the more serious situations you should never ignore. Every medication has a bright side and a dark side. Tadalafil is no different. The most common side effects are usually mild: headaches, facial flushing, nasal congestion, back pain, and muscle aches. These happen because Tadalafil relaxes blood vessels throughout the body, not just in the penis. For most men, these effects fade as the drug leaves the system. But there are important warnings. Men with heart disease who take nitrates must never use Tadalafil. The combination can cause a dangerous drop in blood pressure. Overdosing or recreational use can lead to chest pain, vision changes, or priapism, an erection lasting more than 4 hours, which is a medical emergency. There are also drug interactions. Medicines like ketoconazole or certain antibiotics can raise Tadalafil levels in the blood, increasing side effects. That's why doctors insist Tadalafil should never be treated as a party drug. It's a powerful vascular medication that demands respect and medical guidance. But what actually happens inside your body as it processes Tadalafil? In the next chapter, we'll explore how your liver, blood, and kidneys handle the drug from start to finish. Once Tadalafil enters your body, the real journey begins. Absorption. After you swallow the pill, Tadalafil is absorbed through your digestive system. Peak levels in the blood usually appear around 2 hours after intake, but absorption can range from 30 minutes up to 6 hours. Metabolism. The liver takes the lead here. Using an enzyme called CYP3A4, it breaks Tadalafil down into metabolites. The fascinating part? These metabolites are thousands of times weaker than the original drug, which means they don't really affect your body. Distribution. Tadalafil binds strongly to proteins in your blood, circulating throughout your body. This is why some men experience side effects like muscle pain or flushing. It's not just acting in one place. Elimination. Finally, your body gets rid of Tadalafil. About 61% leaves through the feces and around 36% through urine. The average half-life is 17.5 hours, which explains why the drug can remain effective for up to 36 hours. So, when people call it the weekend pill, they're not exaggerating. Your body literally holds on to Tadalafil longer than most similar drugs. But here's the big question. After knowing how it works, its benefits, and its risks, is Tadalafil really safe for long-term use? That's what we'll uncover in the final chapter. So, after everything we've seen, the science, the benefits, and the risks, can Tadalafil be used safely for months or even years? Clinical studies show that Tadalafil is generally safe for long-term treatment, especially at lower daily doses, like 5 mg. In fact, many men use it every day. not only for erectile dysfunction, but also for prostate health and urinary symptoms. The key point is monitoring. Doctors recommend regular checkups to make sure the liver, kidneys, and cardiovascular system are handling the medication well. For most healthy men, Tadalafil doesn't change hormone levels, sperm quality, or fertility. That's good news. But, and this is crucial, long-term safety depends on using it the right way, never mixing with nitrates, never abusing high doses, and always respecting medical advice. Misuse or recreational use can turn a safe therapy into a dangerous gamble. In short, Tadalafil can improve not only sexual health, but also overall quality of life. But it's not a magic pill. It's a tool. And like any tool, it's only safe in the right hands. And now, let's wrap up everything we've learned today with a conclusion that will tie it all together. So, what happens when you take Tadalafil? We've seen that it works by blocking the PDE5 enzyme, allowing stronger and longer-lasting erections. We also learned that it's not just about sex. Tadalafil can improve urinary symptoms and even help in certain heart and lung conditions. We explored the timeline of its effects, up to 36 hours, and discovered how your body absorbs, metabolizes, and eliminates the drug. And of course, we uncovered the risks and side effects, reminding us that Tadalafil should always be taken with medical supervision. The bottom line, Tadalafil is powerful, effective, and, when used responsibly, safe for long-term use. It's more than a pill for performance. It's a science-based treatment that can restore confidence, intimacy, and quality of life. But here's a final question for you. What happens if you take Tadalafil every single day? Is it a good idea or a dangerous one? That's exactly what we'll cover in our next video. Don't miss it. If you found this video helpful, remember to like, share, and subscribe, and leave a comment below. Have you or someone you know tried Tadalafil? What was the experience? Your story might help someone else.